I just want to say this, and I want to make an announcement. Thank you for all the crisis workers. I've seen people from Kentucky, Seattle, Chicago, everywhere. Like, I can cry right now of how much help that they are. Like, I am in awe of how many people. One lady was like, I was gonna come and I quit my job because they didn't want to give me leave, and I quit because New York needs help. And I was like, girl, come on now. Because
No, really?
She said that. She said her job didn't want to give her leave, and she quit. And she said she came to New York to help. She was from Kentucky,
Wow. Tianka, I am so happy that you're here with us today. And I know, of course, it's tough times for you. You are a nurse. You are on the front lines. You are handling business right now. Unfortunately, during this pandemic, that has really changed all of our lives right now. So Tianka, what made you want to become a nurse? And I'm sure what you're going through right now was so unexpected.
My stepmother's a nurse. She's a hospice nurse, actually. So that's kind of,
wow.
She loves her job. Yeah, she does hospice. So she was like, why don't you go into nursing? You'll have a job for life. They say when you do clinicals, you find your love. And I'm working towards getting to my love, which is working with the babies, the NICU. That's where I want to be. So,
really?
But for now, yeah, that's actually where I fell in love with the NICU and clinicals. But I'm working with the adults now. So that's why I'm indirectly working with COVID patients as right now.
Exactly. Which is what I wanted to really understand. You're working directly with COVID-19 patients, hands-on.
Hands-on.
You're taking care of COVID-19 patients.
Yes. Yes.
Okay, so what does that entail? What does that mean?
Because it's a respiratory disorder, we're monitoring a lot of respiratory things. So we're making sure people are breathing okay. We're making sure whatever breathing apparatus they use, whether it be a nasal cannula or a mask, they're accessible to these things, and they have these things to be able to breathe. Some people are on a 0 to 10. Some people are at a 1 where they're okay. They have a nasal cannula. That means, like, you know, the little prongs in your nose. It comes around your ears. Ooh. Just a little breathing thing. They're okay. They can walk around. And some people are on the higher end of the spectrum where they might not be on my floor, but they might be in critical care where they're on a vent or they're on a BiPAP where it's like a whole mask and it goes over your head and it's really helping them to breathe. And then, of course, we're giving them their regular meds. So a person that has COVID-19 that doesn't, you know, disregard the hypertension or the other things that they have, and we have to give them but we're taking care of them. It's like we're taking care of them as they were in the hospital, but now they have an extra disorder, extra virus on top of that.
How do you protect yourself? Because I know, of course, you're going to do everything you can to take care of the patient, but it has to be scary times because we're so unfamiliar with COVID-19.
We try to protect ourselves with the gear. Of course, I take my vitamins. I make sure if I feel any way, I make sure I protect myself. I will take days off if I need to. Like, if I'm feeling under the weather, I'll take a nice rest day, sleep day. Because sometimes all you need is rest. So you rest, you take some tea. Like, you just make sure that, and then you're taking vitamins just to make sure your immune system is a little bit more, boosted up. And of course, our protective gear is there. So we make sure that we're donning off and on our protective gear in the right manner so we can protect ourselves from every patient.
Has there been other healthcare workers that have come to help at your hospital? Because we're hearing stories about...
Girl, let me tell you. Really? Honestly, I just want to say this, and I want to make an announcement. Thank you for all the crisis workers. I've seen people from Kentucky, Seattle, Chicago, everywhere. Like, I can cry right now of how much help that they are. Like, I am in awe of how many people. One lady was like, I was gonna come and I quit my job because they didn't want to give me leave, and I quit because New York needs help. And I was like, girl, come on now.
No, really?
She said that. She said her job didn't want to give her leave, and she quit. And she said she came to New York to help. She was from Kentucky,
wow.
Yes.
Isn't that something special?
I can cry with all the gratitude I have for them because they don't have to come.
No, not at all.
They don't have to come. So we have people from all over the United States coming. To be honest, I don't know if I would do it because to be away from my family, to risk my life, to be, it's kind of, it's a
in the
hard
epicenter.
Thing. In the epicenter. It's not little things. It's big things that are going on. And they left their homes, they left their kids, they left their wives, they left their husbands to come help us.
We've heard in the news the stories how hospitals don't have enough protective equipment. I'm sure there's not enough. Do you feel though it's getting better?
I do feel like it's getting better.
Good. That makes me happy.
I think that they're doing a good job at doing what they need to do to get us what we need to get. Every day it's getting better.
Thank goodness.
And every hospital is different. I don't have a lot of friends that work in other hospitals, but from what I know from the friends that do work in the little other hospitals, we all have been as protected as we can be. And, you know, none of us have gotten sick from my immediate circle of nurses.
Thank goodness.
Thank God. So I'm very happy that, you know, we are, you know, they're treating us as best as they can, because if they don't have it, they don't have it.
I was talking to another nurse, and he was basically saying that, hey, if regular people have extra masks, go and drop it off at the hospital, at different medical facilities, because that could really help during this time.
Yeah, I agree.
Yeah, other than that, is there anything else that we, just regular people, can do to help you? Because you as a nurse are helping us. What else is it just social distancing? You would say, please keep practicing that. And if you have extra materials that a hospital can use, drop that off. Would you say those are the two most important points?
Two most important points. And you know, there's like the construction workers, I know that they use the same mask as us. If you're not doing construction right now, please donate your mask because we really need it. Also, be kind of nice to the healthcare workers. I deal with a lot. Sometimes I come home and it's really hard for me. So it's like, you know, the people that I live with, you know, they have to be a little extra nice to me. Or, you know, make sure you're checking in on your healthcare worker friends and family, because they really need it at this time. Granted, everybody's going through it. Social distancing is affecting everybody in a different way. But to be on the front line and to deal with things every day and then have to come home and not go outside, imagine?
Yeah.
You can't do anything. So I'm going to work, stressful, and I'm going to home to stay home. I can't even, can't even go grab a lunch with your friend. Decompress. That's you can't even decompress. So, be a little extra nice to your healthcare workers. Make sure you're checking in on them. Make sure you're calling them and saying, I appreciate what you do. And just be nice. Be nice to everybody you come in contact with. Everybody's fighting a different fight. Some people are really taking the social distancing hard, but it's really necessary right now, because the amount of people that die and the amount of people I see that come in and deteriorate so quickly, it's scary. It's sad,
Tianka, we love you so much. To see how you've handled this with such grace, and of course I'm not saying it's easy, but it's been painful, but the way you've handled it is it's incredible. Your strength, you're resilient,
thank you so
and
much.
I appreciate you so much. And that's not just from me, that's from the entire world. And we love you, Tianka.
Right, Nessa, we'll celebrate our birthday, I guess, when we're able to go outside.
Man, I know. Whatever that is. Love you, Tianka. Thank you.
Love you too. Love you guys. Thank you. Bye.
Love that amazing interview. And I want to hear from you. Like, comment, and subscribe to the Stoop channel so that you never miss out on the latest celebrity interviews.